truly is just a way of thinking. It's a way of looking at your processes and thinking and challenging the way that we currently do things.
I guess those of us who have been frontline staff for many years have said, you know, well, they never ask us. I mean, decisions are made and they never ask us. And this time when they came to us and said, will you be a part of it? We were going, ooh. I mean, we were excited. Capture that distance if you want. We'll take care of that. We write on 13 different pieces of paper when we admit a mom and a baby from labor and delivery. 13. Could my time be better spent doing something else? I think so.
One of the groups actually did a mock patient transport, and they actually took one of the team members and put her in a gown and put a mask on her and actually ran her as a pediatric patient through some of the paths that the patient would travel with. She had a very eye-opening experience that she shared with the group, and it was very informative.
What could we remove out of this system that might be wasteful? Distances walking or time spent on things that aren't adding any value to the patient experience. Out of these events, we've been capturing all of the ideas. There's lots of good ideas for things that we can do right now, or things that, you know, in just the art of communication, understanding, oh, I didn't realize that's what you needed, or, you know, the other department not realizing what times the schedule ran or the demands that are on that department.
What we're looking for is not so much the anecdotal data, but the data that supports those anecdotal stories to validate that the numbers exist as they are reported today. And actually getting the timings and the hard data of where the patient is traveling, how they're traveling, how long are they waiting, how long does it take for them to go through each service line.
Well, I think it's great. I think it's great because it really is in the eyes of the patient, and I don't know, we've done lean work before too, but we've never, because I'm in the lab, we don't actually have patients in the lab, so it's all about our stuff more so. This is really good.
So we need to know what's happening right now and where we have opportunities to cut waste out of the process so we can design a better process flow in accordance with the 7 flows of medicine to treat the patients not only that are coming in today, but also those for 2016 and the future.
Miami Children's, we invested in lean in terms of the number of people, in terms of the types of training, as well as the types of projects, in the hope that once we promised an experience, it would be throughout the house.
Lean brought to our department the ability to unite several different areas that were once very segregated. We have several different areas of responsibility, from prior to the patient arriving, scheduling, the patient actually coming in, how we process paperwork. And what we've done is use lean in all of those areas to streamline our processes. And what we've seen as a bottom line impact is a cost avoidance of $415,000 in just one of our cost reporting centers.
Several ways we've utilized lean in the OR. One was our SPD department, sterile processing department, where we worked on our trays, and especially in one of the rooms that we worked on was our neurosurgery room. Then we took it out to the OR suite itself. So what we did was we minimized the number of instruments in this tray. Because one thing we wanted to do, we were counting all the instruments in the tray, so we had to minimize that number so that we could get our patients in the room on time. With lean now, we have a really nice specific format that we're following.
So in the first quarter, we did value stream maps, and we did it of every division. And then in the second quarter, we implemented Kaizens, which had been determined from the value stream maps. I reviewed last quarter 2008 data with 2009 data to see if any of these lean methodologies has actually increased our volume. And in fact it has, and it's across the board in all of our divisions.
The discharge process was probably our biggest one that we did. We looked at the entire spectrum, and it could take anywhere from 8 hours to get from the start that the order was written for discharge to when the actual patient was discharged. We were able to reduce it to about 3 to 5 hours by the end of the tri-storm period in which we did. We did a visual management tool which included bedboards. We initiated magnets in each of the patient bedboard units so that we could identify what process of not only the admission but the discharge the patient was in. These bedboards are located in all of our inpatient nursing units, and it expedites and tracks what the timelines are of the patient while they're in the hospital.
One of the things that Lean taught us, shall we say, is this whole of single piece flow, so we don't batch things, and that's pretty counterintuitive to everybody, because I think everybody who's working, when they batch, it seems more efficient to them, but it really does slow down the process significantly. So it's been amazing to me that just by eliminating batching, I think we probably save almost a significant part of the whole process, 20%, just by eliminating how we do it. Not we're doing all the same things, but we just do it a little differently, and that's been impressive to me and others in the department.
The dissemination of Lean throughout our organization has become a part of our routine, and in our future, I'm very encouraged to see employees thinking about Lean as how they do their work every day. And as we develop and continue on this journey of our Lean process improvement, I think we'll continue to see that value back to the patients and back to the families, and the satisfaction with them, but also with our employees.
Our hope is that we will demonstrate to you what these results look like over the next few months, although we already have exciting results to share with you in the meantime. And our promise to the community is that we will just continue to drive this relentlessly until we eliminate errors, provide the most optimal care at the best cost.
Dozens of staff, physicians, patients, and parents huddle in this North End warehouse.
And then they are thinking of another policy.
This is a new experience for many here, and listening to the voice of the patient is the key to success.
I was overwhelmed this morning, and I felt, did I have a place here? But then I spoke up, and I'm feeling I'm being heard. I really am feeling I'm being heard.
And you know, the project that when we finalize and get to build is going to be so much better because of the work that you're doing here.
By day 5, it all comes together as groups share what they learned.
So that's over half an hour right there of a patient's time that's improved by us co-localizing services.
Each one of our patient rooms offers a room-in feature, so there's a place for a parent to stay with baby, and that just ensures that that bond happens and that they can stay nice and close together.
So we talked about adjacencies. You'll notice the trauma rooms are kind of towards the center, away from where the traditional EMS bay is, but that's to accommodate access to the roof for the helicopter coming.
I have never witnessed what I've witnessed here in the last 2 days. I wanted to say a very, from the bottom of my heart, respectful thank you to each one of you for the leadership that you've shown, for the willingness for patients and families to step forward, and for providers to position patients in the rightful place at the center of everything we do. So, world class, thank you.
The IDEA concept helps promote a culture within our facility. It's not built upon just a single change process, but it's built upon the premise that all employees are a problem solver. No idea is a dumb idea. As those ideas are implemented, the employees feel empowered and engaged, and all those ideas begin to build and make a big difference. In our facility, just so far this year, we're approaching $30,000 in idea or project savings, and we've improved our service, some of our clinical processes, so we're providing better clinical care, better service, and ultimately it's just going to help the facility be more operationally efficient and viable in the long term.
Some of the tools we use in leadership standard work are huddles with our frontline staff, and it's a great way to start the day and discuss what's important and what's on the horizon. We also have the concept of hourly rounding on our patients, which is key in keeping them safe, as well as meeting their service expectations of managing pain, helping them with ambulation, etc. Idea boards are crucial in helping staff provide key input to improve the process on their unit. all of us as leaders here in the Urban North region and throughout Intermountain round on our employees, and likewise our bosses round on us. And during that period of time, we use our standardized one-on-one templates to ensure that we cover everything that's of importance.